In today's video, my dear woman, I want to give you a couple information about the best natural vitamins that really can help you if you want to prevent blood clots. Blood clots are really dangerous because they cause heart attack and stroke and much more problems in our body, so please pay attention. When I say blood clots, I mean a clump of blood that turns from liquid into a more solid form inside your blood vessels. Normally clotting is good. When you cut yourself, clots stop bleeding. But when clots form inside the arteries or veins, where they shouldn't, they interrupt blood flow. If clots block blood supply to the heart, that causes a heart attack. If clots block blood flow on the brain, that causes stroke. Both are life-threatening emergencies. Clots can also lead to another complication, like pulmonary embolism, if a clot travels to the lung. Deep vein thrombosis, organ damage, even death, because women over 50 are more likely to have other risk factors, like high blood pressure, changes in the vessel walls, less physical activity, sometimes hormonal changes, the risk is higher. And that's why it's unbelievably important, especially for you women after 50 years and older, to take good care of yourself, especially your blood and heart, because you are in a much higher risk of developing those very dangerous situations. I want to give you a couple of statistics from 2000 to 2025, what is really happening right now. We need to see the scope, the fuel, the urgency. Globally, cardiovascular disease, which include heart attack and strokes, are the leading cause of death. In 2000, around 40 million died from cardiovascular disease globally. By 2019, that rose to close to 18 million deaths per year. More recently, in 2022, almost 20 million people died for cardiovascular disease worldwide. That's approximately 32% of all global deaths. Of all those cardiovascular deaths, about 85% are due to heart attack or stroke. So from 2000 to 2022, the numbers of deaths rose by several millions. We have better treatments, but the aging of population and persistent risk factors like obesity, diabetes, other type of inflammation, and most important, we do not take care of our body. We eat unbelievably ultra-processed food, and we cure everything with the chemical synthetic medications. That's why people all around the world massively dying for the problems with the heart and the blood vessels. Now, I want to tell you about 3 vitamins that are especially important when you talk about preventing blood clot risk. Vitamin B12, vitamin B6 and the folic acid. These are sometimes called bivitamins, and they work together in the way that help reduce harmful substances in the blood, support brain health and reduce inflammation. What these vitamins do in relation to the blood clots? They help control homocysteine level in the bloodstream. Homocysteine is an amino acid. When homocysteine levels are too high, a condition called hyperhomocysteinemia that increases risk of damage of blood vessels, promotes clot formation, and increases inflammation. They also help reduce and regulate C-reactive protein, which is a marker of inflammation in your body. High CRP means there is inflammation somewhere, and the chronic inflammation contributes to atherosclerosis, plaque instability, and clot risk. They support brain function, nerve health, and overall metabolism, and that is unbelievably important. And for the next part of the video, I really want to explain to you what is exactly homocysteine and what exactly is C-reactive protein. Homocysteine is produced in the body when you eat protein like methionine and amino acid. Normally, your body recycles or converts it into other harmful substances which help of B vitamins. If those vitamins are lacking, homocysteine builds up. High levels of associated with high risk of heart disease, stroke, blood clots, and also neurodegenerative issues. So controlling homocysteine is one pathway of reducing clot risk and protecting vessels. C-reactive protein is made by the liver in response to inflammation. Inflammation is the body response to the damage, infection, or irritation by chronic inflammation. Low grade over many years is harmful. High sensitivity (CRP) tests can detect small increases in CRP. Elevated CRP is associated with high risk of heart attack, stroke, and overall cardiovascular disease. And this is unbelievably important for you to take in good quality supplements or eat good quality food that contains those vitamin B, all B complex, especially vitamin B6, B12, and the folic acid. Now the practical part. How much of those vitamins you should aim for in your diet or supplements, especially as women over 50. Vitamin B12, use 2.4 micrograms per day from food or supplements. After 50, absorption often decreases, less stomach acid you have. So many experts recommended use fortified foods or supplements, so may need higher doses under medical advice. Next one is vitamin B, or Pyridoxine, 1.5 milligrams per day for women over 50. Important in the homocysteine metabolism and also reducing inflammation. Be cautious. Very high doses, well above daily needs, may have side effects. And the folic acid, you will need 400 micrograms daily. For adults, if you take in supplements, folic acid is used if diet followed form food. Some situation like a certain genetic variation, folate deficiency or elevated homocysteine may call for higher supplemental dose under medical supervision. As I said it many times before, you always need good quality medical consultations that someone can make you perfect natural remedy programs and will explain to you how to use those vitamins, especially if you already use chemical medication. But those vitamins are crucial to prevent blood clots and prevent heart attack. Blood clots are unbelievably dangerous in today's modern world. How to take them? If you get enough from the food, that's ideal. But because absorption of vitamin B12 often decreases with age, supplementing or using food fortified with vitamin B12 is wise after 50. Take vitamin B vitamins with meals, especially if the meals contain a little fat for better absorption. Through B vitamins are water soluble. Be consistent. Daily intake is better than sporadic large doses. If for certain medication, for stomach acid, metformin, etc., or with gastrointestinal conditions, check with your doctor. They may affect vitamin B absorption, and that is unbelievably important. So you really must find good quality vitamin B supplements for. That is probably second best way to use vitamin B for preventing blood clots. But even better, I'm going to recommend you best food in the world that contains those vitamins. Let me share with you the food riches in vitamin B12, B6, and the folate. So you can include them in your daily meals. Vitamin B12 you can find in animal foods are the main sources. Think liver, beef, poultry, fish, especially shellfish, salmon, tuna, eggs, dairy like milk, yogurt, or cheese. Also fortified with B12, some cereals and plant milks. Vitamin B6 found in poultry like chicken and turkey, fish, potatoes, bananas, legumes like beans and lentils, whole grains and the nuts. Folate-rich foods are leafy green vegetables like spinach, kale, and broccoli. Legumes are beans, peas, lentils, asparagus, avocado, citrus fruits, fortified grains, and the cereals. If you build meals with variety of those foods, you will meet many of your needs naturally. I believe this with all my heart. One of the best defenses against blood clot risk is ensuring your body has the right tools like vitamins B12, B6, and the folate, combined with a lifestyle that reduces inflammation. healthy diet, moderate exercise, managing weight, and not smoking. If you are 50, consider talking with your healthcare provider about testing for homocysteine and CRP levels. And if you find that you are high in those homocysteine and the CRP levels, you must find solution. If you want to learn how specifically with nutrition and natural remedies can remove the risk of heart attack, blood clots, and other cardiovascular disease, call Mario Lab Center and the phone number +385 98 917 9200. This is my office. You can arrange my private phone consultation, or you can come directly to my office, and I will make sure specifically for you making perfect natural remedies program with perfect nutrition. Even I will send you directly the best natural remedies for you in any part of the world, as I do it for the last 25 years. God bless you. God bless your family. See you in the next video. Bye bye.